Children are not exceptional to the brain tumors. So there are certain tumors which specifically occur in children, and in fact, brain tumors are the second leading cause of malignancy in children after the blood cancer. So there are a number of tumors that can occur predominantly in the small brain called cerebellum and also under the big brain. And these children, younger the child, the tumor can become very large silently for the two reasons. The skull is open and it is expansile, and the tumor can keep on expanding without causing any problem. Second thing, they do not know how to complain, so the tumors can keep on expanding. Third, the brain is so soft and accommodative, and it can get accommodated till the tumor becomes very large. That's why it is not surprising that we see large tumors in a very small children, and these tumors in children, younger the child, and more aggressive they are and more malignant they can be sometimes. At the same time, all brain tumors in children are not malignant. There are many tumors which are simple and benign, and despite of large size, we can go and remove them completely. Then it is possible to provide a cure and the children can grow normally. However, recognizing a brain tumor in a child is very difficult. A large head, which should bring a suspicion that it's not that it is a big head, is a big brain. Sometimes that can be an abnormality. Any child which is crying, irritable, not accepting feeds, not sleeping properly, has to be investigated. Now, normally there's a small soft part over the skull which closes around 1.5 years. If it is not closing or the head is continuously enlarging, and any milestones that child is not achieving, for example, they have certain timelines with which they sit, stand, walk and speak. So if these things doesn't happen in time, we must suspect there is something wrong with the brain. Similarly, children are always very active, playful. If they are not playing well, they are falling or tumbling for simple reasons, and we should be able to see and investigate them. And visual defects is often very common in children. Now, they can't see the blackboard, or they are not able to see the letters on the blackboard in the school. It has to be investigated. Obviously, any child which is continuously having fits, or any child who complains of headache, should never be neglected, because adults can have 100 reasons to get a headache. A child complains of headache, it should be taken seriously and should be investigated. One should look at any behavioral change or any kind of a change in the pattern of the attitude of a child. If there is a difference compared to the earlier days, we must investigate, and so that we can pick up the brain tumors early. And once we make a diagnosis, it can be treated very effectively.